All right, Anush, we are live.
Hi, this is Anush. I'm an injector nurse here at Dr. Emer's office in West Hollywood. It's a beautiful, warm, hot day in LA, and we have my beautiful client here. We're gonna do some facial sculpting today. She's absolutely gorgeous. However, she wants a little bit enhancement, and this is what facial sculpting can do for her. Facial sculpting is pretty much using different types of filler to enhance, define, volumize, whatever we need to do depending on patient goals. It provides overall facial harmonized look, so we don't only focus on one area, but we do all the areas. For her today, we're going to focus on her cheeks, lift a little bit mid-face, provide a little bit more volume, make it look more defined and contoured. We're going to work a little bit for adding volume, a little bit in her temple area, and that will provide overall lifted look. It's something that you would normally would not notice even after the filler is done, but it overall adds a great volume to the face and prevents a lot of the sagging that can happen later on with aging. And she's absolutely gorgeous and young and beautiful, but we're just gonna enhance. So we're gonna use minimum amount of filler that we need to use. We're not gonna over exaggerate nothing, but we're gonna just enhance and make her happy. So we're gonna start with her cheeks. Turn to me a little bit, watch your head. And I'm gonna wipe her down a little bit. We numbed her prior to injections, and we always numb our patients because we want the process to be as comfortable as possible. So we use lidocaine, special formulation that we have to provide quick numbing. And she's ready to go. So today I'm going to be using HA fillers, and there are different types of fillers we can use. HA fillers are most commonly used fillers for facial sculpting, although we use also fillers that are collagen stimulators, fillers that are calcium based, and those are a little bit more permanent or longer lasting. HA fillers are reversible, and a lot of times that's what patients like about it. So in case with time they don't like it, they can reverse it. That doesn't happen often, to be honest. It doesn't really happen, but that's kind of gives a peace of mind. So.
And guys, if you got fillers done somewhere else that you don't like, we see plenty of people with that. We can dissolve them for you.
It is very common now. I have a lot of clients coming that have been doing fillers in their lips especially, and it's been migrating, or they don't like the look anymore because trends change, or it wasn't done the way they wanted it to be done. We definitely can dissolve it and start all over again and make it look exactly the way you want it. So even a little bit, you can see how it makes a big difference. You already can see the cheek is more contoured and lifted, even though we used a very little amount of filler. So for our fillers, we can use needles and we can use cannulas, and it all depends on the final goal and the area that is injected. I'm gonna be using cannulas and needles today, most probably interchangeably.
Someone's asking, what are we doing, guys? We're doing female facial sculpting right now. We're just doing the cheeks and under eyes right now and temples. We're gonna do the same thing on the other side. We're gonna come down the face. We are gonna do the lips as well.
So yes, once we work on her cheeks and her temples, we're gonna go down to her lower face. We're gonna a little bit define her jawline. We're not gonna do a lot, so we don't wanna make her look masculine, definitely. We're just gonna give it a little bit more strength, and it will provide more of a harmonized, balanced look with her cheeks and with her temples. And we will definitely work on the lips, which is more of a fun area for all our girls and guys. So the downtime with most of our HA fillers is a few days of possible swelling, possible bruising. We usually see the results immediately, but the final result after the filler is settled and fully integrated with your tissues is going to be in about 2 weeks. So that's where we can reassess and decide if we want to do more. And a lot of times that's how we plan our filler injections. We'll do some, most of them on probably for the first treatment, and then we'll reassess in a couple of weeks and decide if we want to do more. So one of the goals of facial sculpting is improving the symmetry. We rarely want to make the symmetry perfect. It's not our goal, but improving symmetry a lot of times is a great way to enhance the features. Yeah, so you can see my filler is almost done, and we're almost done on this side.
All right, Anush, what are we doing now?
So we're doing cheek fillers. Right now, this is part of our facial sculpting, and we're starting with cheeks on my gorgeous client because cheeks is her main focus today. Just volumizing it a little bit and lifting it and providing more contoured look. Definitely, it's something that goes perfectly with her face, with her natural features, and this is something that we always keep in mind. We don't want to make someone look completely different unless there is a certain area they want it to be looking completely different, but most of the time what we want is enhance what you have naturally. And
People are asking, how long are these fillers going to last?
the fillers last, it varies from person to person. These are HA fillers, so they're not long lasting, but they will last you from 6 months to a year and a half. Some fillers are supposed to last you 2 years. It really varies on your metabolism and the way your body will retain the filler. It also depends on whether you're gaining weight, whether you're losing weight. People who do fillers all the time, they kind of get an estimate of how long it lasts for them. I'm gonna move on to her temple area. I want to be a little bit slower doing the temple area injection. They're definitely a great area to volumize. Again, temples is the area where a lot of time we start losing the volume, but we don't notice it. And that can, just volumizing the temples then can change the face significantly enough because it lifts up the tissue, provides more of a support, and also prevents jawling. So anytime we lift the tissue, we'll prevent jawling, which forms over time with age. And obviously the amount of filler we're going to use on someone like my client who's very young and someone who's older who already had some volume loss is going to be very different. So we definitely need to use more filler on someone middle age or someone who has never done fillers before. Most of the fillers done on the face are not really painful. Most of my clients find lips to be a little bit more sensitive area. The rest of the face is pretty tolerable. What do you think?
Yeah, this doesn't hurt at all. I can really feel it. It just feels like a weird. I can hear it more than I can feel it.
Yeah, and this is
feel
what
when
I hear a lot. The people hear it, and the reason you hear the filler going, the kind of a tissue cracking under the needle is because we're closer to your bone, and bone has a better sound conduction, so you literally hear it from inside,
Yeah,
which
you
is
don't
kind of
feel
weird.
it, but you hear it. So that's
you hear
that's why it's a little strange, but it doesn't hurt at all.
Okay. So we're gonna go to her jawline.
Can we erase wrinkles with fillers?
Yes, we can definitely improve wrinkles with fillers. We have other techniques that we use for wrinkles, so definitely using neurotoxin, relaxing the muscle improves the wrinkles just by relaxing the muscle and preventing the skin from creating wrinkles too much and moving too much. We can also use skin resurfacing techniques such as lasers and skincare and peels, which also improves some of the wrinkles, some of the fine lines, depending on how aggressive we go with our lasers. But that's another thing. So wrinkles a lot of times can be formed because of the volume deficit, then we can improve it with fillers. If the wrinkles are due to movement, we can use neurotoxin. And if the wrinkles are mostly because of skin getting older or due to sun damage, then we can definitely use skin resurfacing techniques. We can also use skin tightening and skin resurfacing on a younger patient to prevent wrinkles from forming. So if you start earlier taking care of your skin, you truly don't even need to worry about the wrinkles later on in your life. So right now we're doing a little bit jawline definition, not too much. Again, she's absolutely gorgeous. She's very feminine looking. We don't want to make her more masculine. We don't want to make her jawline too defined, but just provide a little bit strength. Okay, perfect. So we're gonna move on now to more fun part, to the lips, which is fun part, but also the more painful part, unfortunately. So lips is what a lot of my young clients are coming for, and it is a fun part. One thing to consider a lot of times, we want to make sure that we give a more balanced look. So if lips is not the only thing we want to address, we want to make sure we do the facial sculpting, so we don't just work on the lips but forget about other areas. A lot of time my patients start with the lips. A lot of times a better idea is to start with the cheeks or jawline or other areas. The lips definitely are a fun part, and all of us can get it done and have a little bit more fun, more hydrated look. We're going to be using a filler for her, which is mostly for hydration, mostly for a little bit more definition and more plump. It's not going to give a lot of volume, but that's what she wants. She had her lips done before, so we're just going to pretty much touch it up and give a little maintenance. So what I'm using for her right now is Volbella, and it's a pretty thin filler, and it is great for lips because it gives a more hydrated look, natural look. Again, lips are a more sensitive area with our with the type of numbing we use. It's usually not that painful, right?
actually the least painful it's ever been for me getting my lips done.
And that's good to hear. So with the lips, you need to consider your downtime can be a little bit more than with other areas, because lips are usually more prone to getting bruised and swollen. A lot of the patients love the swollen look that they have the first week after the lip filler are done. Of course, it's good to remember the swelling will go away, and you know we cannot keep it forever. And so if you like the swollen look, a lot of times that means you need a little bit more. So next time we can get a little bit bigger pot if that's what you like. And some of my clients ask me, can I only do my upper lip or only lower lip? Of course you can do just upper or lower. I like to always use at least some filler in the upper or lower if that's not even your main point, just because once you get filler done, your lips color looks really great. It looks really hydrated, and you don't want your upper lip look brand new and your lower lip look a little bit more dehydrated. So we like to work on both. And you see we're gonna give her a little bit pout in her lower lip, which we already did. I'm gonna build better her cupid's bow to give it more definition and more lifting, and that's what she wants. She wants more central volume in her upper lip, and definitely she can benefit from having a more defined cupid's bow. Which will look absolutely gorgeous on her beautiful face.
Don't mind if you see like a tear. It's it just directly correlates in my eyes. Like my nerves just don't do well. It doesn't really hurt that bad.
So that's very common, in fact, when we get upper lip done, because it's such a sensitive area in her, and it has the little nerves there that will make you tear up a little bit. So that is a common thing. And I hope to believe that's tears of joy.
Oh, it is. I'm so happy to be in this chair.
So before we do your facial sculpting and decide on which fillers are right for you, it's definitely good to do a consultation. We like to have a consultation done to have a plan of care, which is long-term, not just one-time injections. We have a long-term goals, and we do a treatment that will be working with your long-term goals. For consultation or to schedule an appointment, you can DM us, you can email us, or just call us, and we can arrange that for you. And if you want to get a same-day treatment, definitely it's good to do an in-person consultation, but we do also virtual consultations. So again, lips are an area that is have a little bit more downtime compared to other areas. So it's important for you to kind of leave it alone and let it settle down, because it's gonna swell, especially next day, and it might not look exactly what you want, or it might look bigger than it's gonna be at the end, but it's truly not gonna be that big. So it's good to consider that. And there is some initial swelling during the injection, and that's for happens because of the lidocaine and because of the manipulation of the tissue. that swelling will go away pretty soon, but the filler itself has a tendency to draw water, and that gives additional swelling. What we're gonna do actually, I'm gonna use just a tiny couple of drops or filler for her chin, and this is just again for balancing because we worked on her jawline, we worked on her cheeks and her temples and lips. It's good to just balance it out and give that definition and projection to her chin. Once you start working on some area, it's good to consider all the areas, and that's the goal of facial sculpting. So what we're gonna do is provide a little bit more symmetry to her chin and a little bit more projection. After her filler is done, we're gonna have her sit under the red light, which is a skin therapy that will help her with bruising and decrease the inflammation. So we did today some facial sculpting for my beautiful female patient. She's absolutely gorgeous. We just enhanced her beauty, and just stay tuned. I'm gonna see you soon with some more.
Bye. Thanks for watching. Cute. Good job.